Well, they changed their mind again. Hi, this is Chris Westfall from Senior Savings Network with a small update on what's happened with Medicare Advantage cuts that were proposed to happen for 2015. Announced just now in April 2014, the Obama administration, after some very sharp pressure from the Association of Health Insurance Plans, known as AHIP, an industry leader and lobbying group on behalf of seniors and the insurance industry, has changed their mind. And now, instead of what was expected to be drastic cuts to Medicare Advantage for 2015, they've actually said it's going to be a very slight 0.4% on average increase in the funding of Medicare Advantage plans again in 2015. However, the small print, the very short little tiny subtext of the announcement also says that the Center for Medicare and Medicaid Services is also ending a 3-year trial program during which, now this was right before and through the last presidential election, they've decided to stop propping up the Medicare Advantage programs. The plans around the country that were 3 stars and more, they were getting additional funding through a demonstration program that was funded by the government so that seniors did not feel the effects of the cuts that were in the law of the Affordable Health Care Act, which means the law said right now Medicare Advantage was supposed to be cut so that that money could be moved from Medicare Advantage for seniors over into the Affordable Health Care Act for the people that are under 65. So what's happened is that demonstration program, which was propping it up, is being done away with, and the cuts that were going to happen as a part of just regular funding, because the Obama administration has felt for a long time, and he said this publicly many times, that Medicare Advantage is too overfunded. They're paying more for Medicare Advantage than they do for seniors on original Medicare. So to bring that into equality, they were going to cut down on Medicare Advantage spending. But because another election is looming, yes, the midterms, the administration has held off again on cutting Medicare Advantage. Now, that's great news for seniors. Don't get me wrong. If you're stuck or you're on a Medicare Advantage plan by choice, that's great. Hopefully, you will not be affected. Now, since it's based on an average, certain counties will have more funding than last year, and certain counties will have less funding for their plans. A lot of it is performance-based, which is good. But as I spoke with another client yesterday, this client is 77 years old and works in the billing department for a nursing home, often overseeing the billing with insurance companies of senior clients who have just left the hospital and need to have long-term rehabilitative care in a nursing home setting, just for the purpose of rehabilitation to get back to normal. And she said, I wish more seniors knew what the fine print in their Medicare Advantage contract held for them, because in many cases, their cost on a per-day basis for that recovery care or the rehab after a hospital admission is so much per day, often $200 or $300 per day. That's the full cost of it anyway, and the senior is having to pay that if they're on a Medicare Advantage plan. Whereas if they were on a regular Medicare supplement plan, those costs would be paid. And she says that most seniors think that it's a free program, Medicare Advantage, a free program that they're entitled to. And as such, it must be pretty good because the monthly premiums are $0. And sadly, only when they go out to use the plan do they discover that the per-day cost in the hospital, the per-day cost in rehab, the per-visit cost and all the co-payments, and of course, whatever drug plan they happen to companion into with that health care plan, is not in their best interest. It'd be much better to go shop for a drug plan specific to what drugs they're taking and to have a Medicare supplement plan that pays for all the bills with a stable, set monthly premium as opposed to nothing and then, wow, $1,600 out of pocket for a hospital admission or $1,800 out of pocket right now for one hospital admission. And as we reported last year, for 2014 and going forward, it's only an indication that it's going to continue to rise. Now, the maximum out of pocket for almost all Medicare Advantage plans, that's the amount that seniors will pay out of their pocket for co-pays, deductibles, co-insurance, and all those things when they go to use the service, is now an average up to $6,700 per plan. That's per calendar year. So if you have a major illness, let's say, in December or November, You go into the hospital, you get out. You go in the hospital again, maybe on a readmission, you get out. You have rehab, you have all the co-payments involved. You could potentially pay $6,700, depending on your plan, of course. And then when January hits, guess what? That rolls over yet again. So now you're subject to another $6,700 max out of pocket before you don't pay anymore. And some people think, well, if it's a zero premium plan and you're going to charge me $1,500 or $1,600 per year for a Medicare supplement, obviously I'm doing better with the zero premium plan, right? Wrong. See, my clients tell me all the time, I'd rather have a stable monthly premium because we're on a fixed income. Having a fixed payment makes a lot of sense because it's something you can budget. You know with certainty what that payment is going to be, as opposed to a zero premium plan and then it hits you all at once. They want their $1,600 or they want their $1,800 for that hospital admission, $200, $300, $400, even $500 per day in the hospital. You better look at that small print. So if you're on a Medicare supplement plan now, I encourage you to keep that plan. And let us help you shop the market, because according to the Medicare and You guidebook, which we show all the time, on page 68 in this year's version of Medicare and You 2014, on page 68 it clearly says all Medicare supplement plans are the same. The only difference is how much you pay for that plan. So it pays to shop the market every year and get the best deal every year. The doctors get paid the same. The hospitals get paid the same. It's all the law. If they're part of the program of Medicare, they're getting paid the same amount, no matter which the company it is. So you can either pay for a big brand, and so there's nothing wrong with a big brand company, but if they're spending more time advertising in the Super Bowl than bringing your premiums down, it does pay to shop the second-tier companies. That just means companies you may not have heard of. And if you're working with a captive agent who can only sell one thing, that's kind of like working with a carpenter whose only tool in his tool belt is a hammer. So he's going to go around trying to hit everything like it's a nail because he's only got one tool. Same goes for a captive agent. God bless them. They put all their loyalty and their salary into one company, but they're not independent. They can't look out over the horizon and say, well, we've got a new carrier that's just now come into our state of North Carolina, South Carolina, Arkansas, whatever it is. This new carrier has better rates than what we've got right now. It's an A-rated carrier like all the rest, and let's start offering this to our clients because it presents a better opportunity than we had before. So your agent always needs to be on the forefront looking for those opportunities to bring his clients to the best program available. In many cases, like we just had an agent of mine yesterday tell me she saved a couple $600 per month. $600 per month. They were on an employer plan, leaving Boeing. They were retiring, and they were paying literally $900 per month, thinking that they had a great employer-based health plan that had deductibles and had co-payments and had a network, and it was $900 per month for the two of them. Now they're both on a Medicare supplement paying around $150 a month and thrilled as they can be. And now they have no deductibles, no co-payments, no network that they have to subscribe to, and they're free to roam the country in retirement. So I'm a strong believer in Medicare supplements. I think that's the way to go. I know the growth of Medicare supplements has been continuing and will continue. But this latest news about Medicare Advantage is just kind of comedic to me because we're going into the midterms, and this administration has said we're going to cut Medicare Advantage. We're going to cut it. And now the seniors and the public and AHIP, good for them, they're revolting. And because of that, and the midterms are coming, they don't want to be seen as the party that brings down funding to Medicare Advantage, a very popular program with some seniors. So bravo to the seniors. We win again. But I strongly suggest that you consider a Medicare supplement plan for your future, for stability in premiums, for set, consistent monthly premiums, and no surprise when you go actually use the plan. And no networks and no ability to cancel you and drop you and leave the market because they're guaranteed renewable. All kinds of reasons. But if we can help you shop for a Medicare supplement plan now or in the future, please give us a call. Our phone number is 800-729-9590. My name is Chris Westfall. Thanks for watching and have a great day. Bye-bye.
First question I have is whether your side thinks Medicare Advantage is working well. because I think it's important just to point out that when we keep on talking about cuts in Medicare, what we're really talking about is what Joe alluded to, which is a decision was made a while back to set up a system in which Medicare costs, let's say, $1 under the government program that 80% of people still use and are perfectly satisfied with, and there's no showing that it's not working for them. We said we'd give it to private insurers and we'd give them a bonus of $1.15 for every dollar in the normal plan. And it turns out that people aren't healthier because of that extra $15 or 15 cents. It's estimated that it's costing us about $180 billion over 10 years, let's say $18 billion a year. And essentially what my proposal would do and what the House and Senate proposals would do would say, instead of having the insurance companies get that money, let's take that money. The savings are between $400 and $500 billion a year. Let's make some other changes that would result in actually the 80% of seniors who aren't in Medicare Advantage getting a better deal. So we can address some of the broader issues, but I just want to focus on Medicare Advantage because I haven't seen an independent analyst look at this and say seniors are healthier for it or taxpayers are better off for it. That's what we're talking about reforming. We're not talking about cutting benefits under the Medicare program as is required under law. What we're talking about is Medicare Advantage. And it may be that some people here think that it's working. I know that there are some Republicans who are sitting at this table who don't think it's working. You can argue and say, okay, let's not do Medicare Advantage and let's not close the donut hole, for example. Or there may be other ways you want to spend that money, but I just want to establish whether we've got some agreement that the Medicare Advantage program, which is what we are proposing to reform, is actually not a good deal for taxpayers or for seniors, and certainly not a good deal for the 80% of seniors who aren't in Medicare Advantage, because, by the way, they're paying an extra premium of about $90 a year to subsidize the 20% who are in Medicare Advantage.
Seniors are experiencing rate increases with their Medicare supplement plans at an alarming rate. Our goal at the Senior Savings Network is to shop the entire market for you to bring you the very best value for your insurance premium dollar. All Medicare supplement plans are equal. It's the law. Let our free service find you the best premiums for the plan you're on right now. You can keep the same doctor, same hospitals, just with a lower rate each and every month. Let us go to work for you.